Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the HCPCS book, Level 2. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay, so in keeping with the theme for this week, where I am reviewing these books that we use as medical coders, I did the ICD-10-CM review, and then I did the CPT tabbing demonstration, and now I'm doing the HCPCS Level 2 demonstration. So I'm going to show you guys how I look up codes in here. I'm going to talk a little bit about it, but I do want to say a few things about this first. So this book is published by Optum360 Coding. Now, there are many different publishers for the HCPCS manual, just like there is for the ICD-10-CM, ICD-10-PCS, and the CPT book. When it comes to whatever publisher you prefer, this just happens to be what I prefer with Optum360. If you've been with my channel for a while, you've heard me talk very glowingly about them. This is not an ad for them. They don't pay me for this. I'm just telling you guys what I trust, what I use, what I find most comprehensive. I am a huge book lover. I am an old school book lover who enjoys books. And because of this, I am very particular about the books that I use, because when it comes to being very detailed, I like the way that they are detailed. I enjoy all of the illustrations in their books and their common sense upfront approach. That's what I like. So that being said, if you are looking for a 2021 edition of any of the books, they do have a sale right now on their website. I will leave their link in the description box below. Check it out. It currently is 60% off their 2021 editions. So if you are looking to take your exam later this year, that would be a great place to save yourself some money and get some really good books. So that is just my advice on that one. All right, so let's go ahead and get into this. Now, one little fun factoid before I begin all this. Here's your contents, table of contents, and it's going to tell you everything that's here. A little factoid, and it's telling you about the instructions and how to use the book, right? And their table for like the keys on like what do these characters mean and that kind of thing. And it's all like right here. All right. So fun little factoid is that the dental codes, the D codes, are not included in the official 2020 HCPCS Level 2 code set. The American Dental Association, the ADA, holds the copyright on those codes and has instructed CMS to remove them. As a result, Optum360 has removed them from this product. However, Optum360 has additional resources available to customers requiring the dental codes. So if you visit their website, you'll be able to get to those as you need them, all right? So here's just some more informational stuff. This is the index. Now, the reason that I think that the HCPCS book is not really reviewed so much in schools or in other places is because maybe the instructors have figured that by the time you've learned the ICD-10-CM and the CPT or learning the ICD-10-PCS, this should be a cake. Look how thick the the index is for the HCPCS. And I'm sure you heard the the sarcasm in my voice. That's it, guys. It is not that big a deal. But I am going to do a demonstration on the lookup of the codes here shortly. But I will say this also. Not every facility is going to use these codes in this book. Not every insurance company is going to accept these codes that are in this book. So that is why I'm going to tell you guys, you got to make sure that you are asking questions at your facility. If they don't use it or you don't need to report it, because sometimes it's already covered in a CPT code and they don't need you to report the HCPCS code. And that could always be, or it could be an insurance specific HCPCS code that you would report instead of reporting a CPT code. There's a lot of different combinations, a lot of different factors that go into it. The HCPCS book is used in both the inpatient setting and the outpatient setting. So that is something that you should know. Everybody has the potential to use this book, but it's depending upon who and what and why you're trying to use it. So I know it's a little confusing, but it will get easier. So the main thing is you're going to learn how to look stuff up here shortly. All right, so here is the overwhelming list. And the other thing that I want to talk about too is if you are in a clinic that is issuing out like any kind of orthotic, right? Any kind of device. A lot of times the HCPCS code will actually be on the box itself. I have seen namely in the podiatry clinic, they have different inserts for their patients, and the HCPCS code is right on the box. It'll say HCPCS code, and then it'll give the specific code for that brand or for that particular device. So if you are unsure and maybe the provider is writing down the brand name of whatever thing that they're issuing to the patient, look it up on the internet and see if there's a specific HCPCS code for it. What is the HCPCS code for whatever you're looking at and whatever the brand name is? And sometimes it'll come right up, because I've had that issue before too, where they had gotten a new orthotic in the clinic and I had never heard of that orthotic before. And so I was like, okay, where's the box? And they were like, well, we already threw it away. Okay, well, and so I had to look it up, and sure enough, I was able to find the code that fits specifically for that device or that orthotic. So I was like, okay, cool, you know. So that is just something to know. It really helps for you guys to be very engaged with the staff and really talk to them and find out, what are they issuing? Are you issuing anything? Because all of your medications, your durable medical equipment, and you know, just different things are going to be in this book. So that is where you're going to find these codes a lot of times. All right. So the thing that I like about Optum 360 is they always have these little notes here. They have like just different tips, and sometimes they have just this different stuff here, like this red instructional notes. This is just telling you that this is covered in the internet only manuals back here. So this is a section back here. It's quite large, and it's talking about just these different things here. So that way you guys, if you have to look at this particular code, you can look up for more reference back here. So that is just something to know. All right. So this first one is transportation services, including ambulance. So that covers A0021 through A0420. And down here, of course, you have your you have more little advice and instructional things here. Special coverage instructions, non-covered by Medicare, carrier discretion, because as we all know, the insurance companies do call the shots. Quantity alert. When you are coding for injectables, that is something that you're going to see a lot of times. And when I demonstrate the lookup of one of the injectables, I'm going to be able to tell you guys about that. But quantity alert, you always want to make sure that if it is something that is by quantity, then you need to know how much. All right. So if that's an issue, that is something that you're going to need to talk to your providers about. All right. Because this details has to be there in order for these to get coded properly. All right. This is the dot is for a new code, and then recycled / reinstated, and then a revised code. And then of course, skilled nursing facility excluded, and then DME POS paid, and there's an AHA coding clinic. Whenever you see AHA coding clinic, it means that there's further discussion about it in the coding clinics. The coding clinics are really great at clarifying when and why to apply codes. So if you haven't had a chance to check that out yet, you really should. It is in a lot of the encoders. They do have, like, sometimes they have like a stack of books, and it'll be like where you can access those coding clinics. Sometimes they don't, so it really all depends. But you can access this, and I will leave the website in the description box. There you can subscribe to it, so you can check it out. But it is very, very helpful to be really specific about just different things. So it's anytime you see this in this book, it's alerting you that there is a coding clinic out about that. Okay. And then the CMS is IOM is the Internet Only Manuals, IOMs, okay? And then ASC payment, and then that's it. So, well, there's more on the other side, but, you know, it's just different things. Like I said, it'll give you like the tips and stuff about, like, for example, this one, platforms for home glucose monitoring. Let's see if I can creep forward. There we go. I'm getting better. Platforms for home glucose monitoring, 50 per box. Some Medicare contractors monitor platforms for diabetic patients using home glucose monitoring devices prescribed by their physicians. Some commercial payers also provide this coverage to non-insulin dependent diabetics. So that is something that, you know, it's like a tip, it's a helpful tip. And again, it's designed to help you. And look at this, look at these awesome illustrations they have here. So pretty cool, I think. All right, so moving right along. Then we have outpatient prospective payment service. So there's also, that's in this section from C1876 to C2624. And then we have our durable medical equipment from E0100 to E0160. And there's different types of like crutches and things like that in here, walkers, attachments. And again, you have to watch out on these quantity alerts whenever you see that little check mark, right? You want to make sure that you're paying attention to the quantity that is being issued. All right. So then we have procedures, professional services, temporary. So sometimes with some insurance companies, they're going to have you report this code. And sometimes with other insurance companies, they want you to report a CPT code. So for example, like for colonoscopies, okay? Here they have the G code, but this is like a Medicare code, right? So an individual, and as defined here, an individual with ulcerative enteritis or a history of malignant neoplasm of the lower gastrointestinal tract, sorry guys, is considered high risk for colorectal cancer as defined by CMS. So it's telling you like kind of what the definition is here. So these are these Medicare codes for these types of screenings. So that is something that, you know, for you to know. And again, it's pointing you to these internet only manuals in the back for more information. Okay. And then we have, let's see. Alcohol and, you know, abuse treatment services. We have that series of codes. We have any of the medications that are administered other than oral. So like these are injectables from J0120 to J0360. And they're all here. Okay. And then we have more temporary codes. And this is just a variety of temporary codes. And then we have orthotic devices and procedures. So different things that we have here from L0112 to L0457. And then we have lots of really awesome illustrations. Look at that. See, guys? Really great illustrations. Awesome illustrations. Then we have medical services, M0075 to M1041. Pathology and laboratory services. Q codes, these are also temporary codes, all right? And then like just an example is like the casting supplies, long leg cast, pediatric, 0 to 10 years old, and then 11 years plus. So these are going to be like reported if you're reporting these like on your subsequent visits as they're coming back in and getting a fresh cast. You would never report this like on an initial casting, like initial fracture, either closed treatment or the reduction, you wouldn't code the Q codes, the HCPCS codes in conjunction with that primary CPT code, because for the first time that they're getting their treatment for like a broken bone, because it's already included, like the cast materials and everything, that's already included in that. So you wouldn't, code for these. This is when they're coming in for their subsequent visits and they're in that global period that you would be applying these to the application of a replacement cast. So that's just something to know, all right? Let's see what else. Diagnostic and radiology services, temporary national codes. These are non-Medicare. There's lots of different things here, lots of different services that can be provided here. Some of these S codes are home care training, family per 15 minutes. So sometimes if there's not something that will cover it in a regular CPT code, but it'll be here, and if that insurance company really wants this code instead, then that's what you're going to be using, okay? And then we get to the appendixes. Oh, wait, did I skip one? Yes, I did. Whoopsie. I skipped a couple, actually. National T codes. And then we have vision services. So this is also for vision services, different things. For the lens, right? Per lens, and like the different types and the different sizes and stuff like that. So trifocal, glass or plastic, just different ones. And then we have Appendix 1. This is the table of medications and biologicals. So this is going to be listing all the things that can be injected, okay? And I'm going to show you guys Kenalog here in just a few minutes. But I'm going to keep going. Modifiers that are covered in this book, right? And it's giving you all the ones that you need to know for this book, okay? So it's just, the books are designed to help you guys. All the information that's in here is designed to help you. So make sure that you're really reviewing, okay? And then we have abbreviations and acronyms. A lot of times people will ask me, well, Blue, do you have a recommendation on, an acronyms book or an abbreviations book? Oftentimes it is right in the book itself. So that's what I can recommend. And then internet only manuals. Like I said, you saw all that red lettering. That's what this is covering. Okay. And then it goes quite a ways. So just so you guys know, be prepared. All right. And Appendix 5 has the changes. All right. This is for 2020. Obviously, when you get a newer updated book, it's going to be for the current year, right? And then Appendix 6 is place of service and type of service. This is a very good thing for you guys to review. I'm just saying. And then we have the deleted crosswalk for Appendix 7. And then Appendix 8 is the glossary. So everything that you need to kind of figure out, like, what does it mean in this book is covered back here. And then Appendix 9 is the quality payment program, the QPP. So here's all of the information regarding that. And that's it. So I'm going to be demonstrating now how to look up an injectable. So let's go here. So hold on one second. Okay, so we're back to Appendix 1, the table of medications and injectables, right? And biologicals, I'm sorry. So we're going to go to Kenalog. Kenalog is a very popular medication that they use when they're doing like joint injections. So it can be called different things, all right? So that is something that you guys need to be aware of, okay? Let me bring it up here. So here we go. Make sure I'm still on the shot. Okay, so Kenalog right here. And this comes in 10 milligram increments, right? And it's intramuscular, and it's J3301. So if we flip to J3301. We have it right here. Let's creep forward. I did it. All right, so injection, I don't want to say it. I know I'm going to say it wrong. So anyway, not otherwise specified 10 milligrams. Use this code for Kenalog 10, Kenalog 40, Tricort, or Keneject, or Centicort, or Triam A, or Trilog. So all of those can fit under that, depending on which one they're injecting in particular. That falls under this category here. Okay, and remember, it's telling you to do that quantity check. Make sure the quantity alert, because like I said, sometimes it's injected in 40, so you would have to use like 4 units of 10 milligrams. So depending upon what they're doing for that. So it's just something to know and to be aware of. So here we go. And then let's see, what else can I demonstrate really quick? Let's go with, there we go. All right. So let's go for an arm sling, okay? A4565. And there's no decimals in this, okay? Just so you guys know, that's the way the code is. 4565. Right here, slings. So you look up arm sling, right? If they give them an arm sling, right here, deluxe. And they have mesh cradle, and they have universal arm sling, which also falls under that same code, A4565. So, it's just dependent upon however it's worded, it's going to give you the same code. So they're all the same code there. But if you have an arm wheelchair, whatever, it's going to change. But there you go for your slings. All right. So this is a very, like I said, it's a very good book to get comfortable with, to get familiar with. And, once you start understanding like what it is that your practice is actually doing, it's going to get a lot easier. But just take it a step at a time, one day at a time. It's Rome wasn't built in a day, and your skills as a medical coder are going to build over time. Okay, so try not to get overwhelmed with it. All right. So at least that's just my advice. So if you haven't already, I hope that you'll subscribe. Don't miss out on any of this content by hitting that alert, that notification bell, so that way you guys can be alerted every time I post a new episode. And you can catch most of my new episodes weeknights at 7:30 p.m. Central Standard Time. So I'm going to go ahead and wrap this one up. But thank you so much for joining me, everybody. And I will see y'all next time. Bye.